In May 2025, over 5 days, key stakeholders gathered in Abuja, the nation's capital, for a unique engagement. A national law enforcement agency training on harm reduction, HIV and public health, organized by the National Agency for the Control of AIDS in collaboration with the Institute of Human Virology IHVN and with support from Global Fund. The goal was to bridge the gap between public health and public security in response to Nigeria's drug use. Participants included officers from the Nigerian Police, the Nigerian Security and Civil Defense Corps, the Correctional Service, the National Drug Law Enforcement Agencies, representing 10 states implementing the needle and syringe program in Nigeria, facilitated by leading experts in harm reduction, Professor Wakawa.
You want to be the Supreme Court, whatever you say, whether right or wrong, it will go with it.
Let me start by addressing something he said. Yes, the police have the right of egress and ingress to break it, but there is a time limit to that.
The session emphasized empathy, collaboration, and public health approach to issues of drug use.
Okay, normally police officer is supposed to use a search warrant when you want to search somebody.
But in this case, you did not use the
But the only time you may not use it is
bound to the use of the barrel of a gun, intimidation, and body shaming the victims of drug abuse. But with this lecture, this seminar, this training within this short time, we've been able to know that drug abusers are part of the system. They have their rights, and we need to bring them close to us. We have to apply empathy, care, and also respect their fundamental human rights. And by so doing, they will have a better chance to communicate with us and tell us how we can be of help to them.
So the experience has been very awesome. Before I came in, I have some basic knowledge of harm reduction in key population. However, I was skeptical about how to integrate the law enforcement agencies into the harm reduction, bearing in mind the laws of the land and the policies. But with this experience of this training, I've been able to, they've opened my insight to how law enforcement can play key roles in conducting harm reduction and still navigate the policies, the norms and cultures of the land. And then also, I've also gathered experience on how to
Highlight of the workshop was a field visit to Youth Rise Nigeria's drop-in center in Nyanya, Abuja, where officers witnessed firsthand how harm reduction services are delivered compassionately, safely, and effectively. The law enforcement agency also engaged directly with community members, peer educators, outreach team gaining new perspective on trust, dignity, and public health in action. As the workshop concluded, participants agreed to cascade the training within their ranks and support state-level advocacy to protect and expand harm reduction program in their states. Drug Harm Reduction Advocacy Network remains committed to building partnership that save lives. Together with the IHVN and NACA in collaboration with the Global Fund security agencies, amongst others, we move one step closer to a safer, healthier, and more inclusive Nigeria. Changing minds and protecting rights, reducing harm in Nigeria.